Thankful for smiles. Thankful for friends. Thankful for hugs.
Thankful for trust.
Thankful for leaders.
Thankful for each other.
Thankful for our families.
Buenas, I'm Troy Torres with Kandit News, live here in studio on the 7th floor of the DNA building in Hagåtña, Guam. And my guest in studio is Christine San Nicolas, the Human Services Program Administrator from the Bureau of Economic Security, Department of Public Health and Social Services. Someone who has a lot to do with welfare on this island, correct?
Correct, yes,
Right.
correct.
Thank you so much for joining us.
Oh, you're welcome. Thank you for the invite.
Yeah. So so you deal with programs like the SNAP food stamps program, right?
Mm-hmm.
Medicaid, public welfare.
Yeah, the cash assistance, correct.
That's the cash assistance, right? Okay. And is there
And
anything
MIP,
else?
MIP.
Which is sort of like the sister program of Medicaid.
Yeah, just that it's locally funded.
Locally funded, yes. Okay, correct. So you know what? Before we get into the whole, because we want to talk about how public health is making things extraordinarily more easy for its they're called consumers, right?
Consumers, clients.
Your client,
Yes.
for everyone on food stamps, Medicaid, MIP, and public welfare, to access benefits. Major changes that are making things easier for the first time in decades, actually, including a new streamlining of your qualification system, where you don't have to get a mayor's verification anymore.
Correct.
So we'll talk about all that stuff first. But first, I want to ask you, as someone who deals with a great number of customers on a daily basis, how happy are you that you are not at Guam Power Authority?
Well, to start off, that I do love my job, regardless of the challenges. But
it just cannot be as challenging as it is for GPA right now.
True.
How many times did your power go off last night?
I think about twice. But see, I always get home late, so by the time I get home, the power's kind of come back on. About twice. Wherever I'm at.
And I ask this because normally when the power is not an issue, one of the agencies that takes a hit in customer service remarks is your division, the Bureau of Economic Security. How come it's not known as the Public Welfare Division?
I'm not sure.
It used
That's
to be
a very
known as the
good
Public
question.
Welfare Division, right?
Well, it's called the Division of Public Welfare.
Division of Public
But then our bureau is Bureau of Economic Security. That falls under the umbrella of DPW. Bureau of Economic Security.
Division of Public Welfare.
Yes.
Okay, DPW.
Yes.
Okay. Well, anyway, so the reason I bring this up is because I know you guys typically get your more than fair share of complaints, and it has to do with mostly, correct me if I'm wrong, every so often, someone who's on SNAP or Medicaid or public welfare has to somehow present documents to public health in order to continue eligibility in the programs, right?
Correct.
And so is that where most of your problems are?
I would probably say yes. So one of it, of course, is the number of documents that we do require, number one.
What are those documents?
So for example, there's different categories on the, on our application. So first is identity. So it could be like a driver's license, pass, just to say this is who you are, right?
Okay.
And then second is for citizenship, right? So it could be like a birth certificate, again, same thing, passport.
And this is to apply?
Yeah, this is to apply.
You don't need to
Correct.
continue providing those documents,
No,
right?
once you submit like your ID, and your birth certificate, you don't have to resubmit it again because we have that stored in our on-base system.
And your ID also has your residency, right?
Correct, right? Can have your PO box, could have a street address. Yes.
Like a power bill.
Yes.
Okay. And so what are the things that you need to provide on a every so often basis so you continue your eligibility for food stamps, Medicaid, etc.?
Yeah. So again, the documents that we currently, besides the mayor's verification, right, is anything that deals with their income. So if it's like check stubs, your VOE, if you're getting Social Security disability benefits, we need those documents to prove the income that you're getting. Right. Those are a couple of things.
And how often do you
So
need these documents?
every renewal. So every time you renew your case, then
Which
you would
is?
have to. So it's every year that
Every
you renew
year.
your case. So you'd have to present those documents as well to show that there's. And then
Before the year ends.
yeah, before the year ends. So and everybody's certification is different depending on when the month that they apply. Now for the SNAP program, there's a thing called a periodic change report.
Okay.
So that's mailed out like every 6 months within their certification.
Okay.
There's no changes. They just kind of indicate that and submit it in, right?
So here are the most common complaints I hear on and off of Kandit is number one, my caseworker didn't call me or didn't email me, and so I didn't know that I was supposed to submit my periodic change report. I was just waiting for my caseworker. Can you?
Sure. So first of all, the periodic change report is system generated. So it's not something the worker has to go in and do. It's system generated, gets printed out like on the 15th or 14th of every month, and it gets mailed out directly.
Which is a reminder.
Right, correct, right.
Okay.
And then
some people don't get that mail, they say.
right. So again, that's hard for us to determine if they do get it, right? Because we mail it out, we don't have control of the post office unless it gets returned for any particular reason. The simplified renewal forms, which is done every year, same thing, it's mailed out a month before the actual renewal date. So like, for example, this is December coming up. So then the simplified renewal forms would have been mailed out like on the 15th or 14th of November.
Okay.
To kind of give them that ample time. And if they know that by the end of November, let's say they don't get their PCR or their renewal form, it doesn't prevent them from us to printing it out for them, and they can actually fill it out.
Okay.
If they come to the office.
And can they download that form online?
The renewal form, no, not at this time, only because it has their personal information.
Okay.
But that's what we have the web portal for. So they should be able to have access to that type of document.
Okay, so we'll get to the web
Yes.
portal in just a minute.
Yes.
So how about the submission of forms? Does it have to be in person? Can they mail it in? Can they email it?
Yet there are various reasons, so they can do it in person if they choose to.
Okay.
We do have drop boxes at Dedito Public Health.
Okay.
We do have a drop box outside at Southern Public Health, but we're also open on the second floor. They can email it. We have 3 different emails, which is North BES, Central BES at dphs.guam.gov,
Okay.
and then South.
Okay. And so you can mail in these forms.
Yes, you can email those forms.
So you can get the form from your offices. Is that correct? You can scan it or whatever on your phone, fill it in, or you can just fill it in paper and take a picture of it and just email it in.
They can email it, and as long as it's clear, because sometimes
Legible.
sometimes when we do get it back, it's not as clear. So we'll ask the client to send
And
it
as long as you do this ahead of time, ahead of your 6 months or your 1 year, there should not be an interruption in your SNAP or Medicaid services.
Well, to be honest with you, because we have lost a lot of eligibility staff, So we still have recruitments that we're waiting to interview. So because of that, we are backlogged, you know. And the truth is, and we tell the clients right now, they're like at the tail end of September that they're trying to renew. But of course, clients come in, phone calls come in, the workers have to stop processing and kind of entertain those calls, right, or those visits.
Will you allow eligibility to continue if you haven't processed forms that have already been submitted?
Oh yes, if they've already submitted their forms, then it's basically prorated. So even if we work on it, we act on it late, and let's just say it's last month, then we still give them that month they're eligible for.
Do you give it to them after the fact, or it will just, there's no interruption?
Yeah, after that, there should be no interruption once we process the case.
But how about before you process? Let's say the paper is waiting for someone in your office to process. Let's say, okay, let's pretend that that my 6 months ended on July 31.
Okay.
And I submitted my paper on July 14. And because there's not enough staff in your office, they weren't able to get to it till August 4th, right? Will there be an interruption from August 1st to August 4th?
No, so that's what I say about proration. So we will actually give you the benefit for July and for August. So you'll get like the 2 months, because it's based on the date that your application or document was received.
Received, okay, not
Correct.
processed.
Correct, right.
So received, okay.
Yeah.
And what about complaints that, these are several people who have complained that, basically they advise other people who are in the program, they say, make sure that you get a stamp received copy, make sure that don't just drop it off, make sure that you get an email response, because sometimes they lose your documents. Is that something you're able to speak to?
You know, paper is very tangible, right? So anything can get misplaced. That's the truth, right? But yes, if you when you come in, and you have the right to ask for a copy of what you submit, and to get a stamped receipt. So like at the Timoning building, we do have a stamp machine at the drop box that you can have it and take a picture of it if you need to. There's different ways, but you can ask for a copy.
And so the most important thing that I'm getting from this, you know, just with the old way of doing things, which continues on as an option, right? Even with the This Is My Benefit system, which we'll talk about in a little bit. The most important thing that I'm getting from this is make sure that your documents are turned in ahead of time.
Correct.
Your 6 month and your 1 year documents.
Correct.
Right?
Yes.
And I think, I mean, I know you guys can't say this because well, maybe sometimes you think it. If you don't turn in your documents ahead of time, that's your fault. That's not public health's fault. And I used to be in government service, so I know about this. I know about some. And sometimes you're gonna have a customer who, who's right though.
Of course.
And their document was lost, or they did everything that they did. Some other employee said to do something that wasn't actually in the rules, and that does happen, right? And I've experienced that myself, both as a GovGuam customer and as a GovGuam employee. I've experienced that. But a lot of times the customer is absolutely wrong and throws a fit.
Yeah.
And really what it came down to was you didn't turn your document in on time that you needed to. Maybe you forgot what your 6 month date was or your 1 year date was. And you know, maybe the day that you went in, public health had to close an hour early because there was a water outage or whatever the case may be. But because you waited, you know, now you have this interruption in services, which is detrimental to many people.
Yeah, of course, definitely. Yeah.
And so that's why I wanted to start this whole thing off with, aren't you glad you're not GTA?
You know, I just have to say that, you know, the staff there, I mean, you don't see what happens behind the scenes. And these guys work really hard. I mean, they understand what the community needs. They understand that the press of a button can give a family benefits. We understand that. I mean, again, you don't see them work on the weekends. You know, they come and they stay back after work to work on some of the cases because they know how important it is.
The post-Malwar, the DSNAP, you guys worked around the clock.
Oh my gosh, yes.
Yeah.
That was like...
Yeah. Well, kudos to you guys. Okay, so let's get to the number one, the new rule that you don't have to turn in a marriage verification anymore. I think this is what's catching some people by surprise. They're like in disbelief that this is an actual thing. So for decades, public health has required a marriage verification. That was for proof of residency, right?
Proof of residency, but also household composition.
Okay.
These are who you say are on your
And so
marriage.
as of last week, you guys don't require that anymore.
No, they still have a choice. It's not, basically it's not one of the primary documents that we ask for, but if a client already has it, we're not going to say, oh, we don't accept it. We'll still take it.
Okay.
But they don't have to go to the mayor's office anymore and say, can I get a marriage verification?
And so I think maybe this one it's just such a big thing that people are wondering whether there's more fine print to this. Is there a catch to this announcement? And so you want to speak directly to our audience. Maybe look at that camera,
that camera.
and just tell them with just as definitively as possible, hey, there's no catch here. There's no fine print. You don't need to turn in a marriage verification anymore.
Correct, right. And again, I'm saying this to the public.
This one, right, this one.
That screen, sorry. So yes, a marriage verification is not one of the primary documents that you have to turn in
Anymore.
If you have it, wonderful. If you don't need to worry about that. There's other ways that we can verify your residency and your household composition. So again, no mayors. You don't have to go to the mayor's office to get that document.
Just like that.
Just like that.
Just like that. And you
Just
guys
like
had this
that.
cleared with all your
Oh yes.
federal partners
Oh yeah,
and
definitely.
all that stuff.
So just whenever we make these kind of changes, we always communicate with our regional partners. Say, hey, this is what we're planning on doing, and we kind of get their blessing, about doing it.
So that was already a big deal. The second big deal is, I'm not sure which one is the bigger deal here, but I guess in the long run, it's this new portal. So this, before this portal came up, the most technological that your division has gotten was to accept documents via email. Would that be correct?
Correct.
Because otherwise, before it was all like come into our office.
Yeah, in person.
And then it was, we can accept phone calls to answer questions. And then it was, maybe you can ask us questions via email. And then it became, you can email us the documents, right? Now, there's this My Benefits system. It's a portal for all of your clients who have SNAP, Medicaid, MIP,
all benefits.
and or public welfare.
Correct.
Right? Which is the general cash assistance.
Yes.
Right? And so if I am a SNAP recipient and I go to mybenefits.guam.gov, it's up on the screen right now, mybenefits.guam.gov on the World Wide Web, there will be something there that says register. Because if you've never logged into it before and you're not logged into the system, you have to register, right?
Correct, right.
What do you need to do to register? Like what information?
So it's going to ask you. So there are 2 videos, right, of how to register and then how to access the portal. What you're going to see. So for the registration, you just need an email address. I believe it asks for your phone number and probably date of birth.
Okay.
So what it does is that if you're an active recipient, that information matches our system.
So is it the email address that you have on file?
No,
the phone number
they
you have
could
on file?
register an email address. It's their name. They're going to ask for their name, their first name and last name.
Okay.
Yes.
How do you guys make sure that it's not going to give someone else's stuff?
Well, because it's linked with our system. So if they enter their name and their first and last name and their date of birth, then it should be able to link to that same person.
I see.
Yeah.
Okay. And I couldn't,
And there's a phone number too.
let's say that you have SNAP services and I know what your birthday is, and I go in there and I put in Christine San Nicolas and I put in your birthday. Am I able to see your stuff?
There is security questions that you create.
Okay.
Right. So again, it's part of the portal, so that you don't access anybody else's information.
Okay, cool. So it's just as simple as this.
Yes.
Some people, and when we put this information out, were saying that it stopped them at the security question. Someone said that the portal wasn't working since yesterday. Are you able to address any of those technical issues?
For yesterday,
Because for some
yeah.
people it's working, for others it's not. I don't know. Is it a browser thing or?
It might be. I mean, I haven't gotten any. So usually people will email me directly about this is the issue I'm having with the portal.
Okay.
And if it's something I can't tell them over the phone, then I try to resolve with our vendor.
The vendor is, who's the vendor?
DMR.
DMR. Okay, so
Yes.
DMR works off of PC related stuff. And so I'm not saying you're
Yeah.
saying this, but I would make the recommendation that if you're using Safari, maybe, and you're having problems, because Safari is a Mac based,
Oh, okay.
what do you call
Browser?
that? Browser, yeah.
Yeah.
Maybe use Google Chrome
Okay.
instead, right? There's no more Internet Explorer, right? They
Yeah, I think they
of
got
that.
rid of Internet Explorer.
So maybe go to Google Chrome, and try using that browser.
Okay.
We ran into these problems when I was in
okay.
the government, and because
Okay.
DMR works on PC based, blah blah blah. Sometimes stuff didn't work on Safari. So that might be the problem that you're having. Is just switch your browser.
Yeah.
Okay, so when I register for this, and if I have, let's say, SNAP benefits, and let's say my monthly amount is $1,300, and in SNAP benefits, and it comes in. It's supposed to come in on the 7th of each month, right? So what happens when I register?
So when you register, then
And create the account.
Yeah, you create the account. Then it's going to lead you to different options of like if you want to review your notices, your benefit amount.
What are notices? Sorry.
Oh, the notices like your notice of action.
What's
So
that?
let's just say that's just saying that whether or not you qualify or not, right?
Okay.
So typically when the ES workers approves your application, then a general notice of action is generated with their system that we mail to the client,
Oh, okay.
right? So if they say, oh, I didn't get my notice, then they can actually go onto the portal and check and see what notices that we have on file. See, it doesn't happen. And then they can also see documents that they did submit.
Okay.
So, we've been mentioning that we had some issues with our portal or the beginning of the fiscal year. So clients, when they may have submitted their documents, let's say October 6th, right? But they go on the portal and then they don't see it on the portal. It's because we weren't able to upload a lot of the documents that were received.
Because of the backlog.
Because of the backlog, right? So we're just saying, we're just asked to be patient. We're trying to scan all the documents that we've gotten, all the applications, and then eventually they'll be able to see it.
So on this portal, are people able to upload the documents into the portal?
Unfortunately, not yet.
Okay.
Not
So
yet.
that's a feature you guys are working on?
Yes.
Okay.
There's a lot of things that we're trying to improve in terms of the Bureau to make it more accessible to clients, right?
Okay.
One is
Where they don't have to go into your office.
Right. So we're looking towards the future. So that's like online applications.
Okay.
Is one of our biggest goals, so they
Which
can
takes
supply-
time to build. Takes
right,
time to build into the
right,
portal.
right. But it's something we are working on.
So what can you do with this portal aside from look at your notices?
So you can look at your notices. You can also look at, like I said, your benefit.
Okay. So I'll
your
be able to
benefit
see
level.
how much of my
Yes.
$1,300 is left.
No, you're going to see your benefit that was given to you. So there's a different app that you would register under that connects with your card, which is called the EBT Edge app.
Okay.
So that actually you can see your transactions of how much is left on your card and see where you went.
So you won't see that on this portal. You'll
No,
just
no,
see
no.
the amount that
Right.
you are. So I'll see $1,300.
Yes, correct, right.
If that was mine.
Yes.
Okay. What else? are
And
you
the
able
other
to
thing too is that I think we added on a new feature. If I'm not mistaken, it should be there. So like medical providers. So if you're trying to see which clinic can take Medicaid or MIP,
Oh, okay.
we kind of link that in.
Okay.
The other was there should be a link to all the EBT vendors on island, like the stores.
Okay.
So if you want to see which stores in Guam accept EBT, vendor EBT cards, then you should be able to see that.
Okay. All right. What else am I able to see by logging into the system?
So there's 3 different sites. It's loading.
Can we
And
go back to the list, Eric?
Yeah.
The which is the poster you made for this I'm sorry, the public health poster. I think it has everything there. There we go.
Yeah, there you go. Yeah.
So what's an appointment date?
So before COVID, clients were being seen face to face.
Okay.
Right. So that was their scheduled appointment to come in. But of course, because we have a waiver, all the interviews are done through telephone. Right.
Okay.
Sometimes it's face to face, depending on the situation.
Okay.
But mostly it's phone calls.
Okay, so that's because the next one said contact information for your caseworker.
Mm-hmm.
Is there a shortage of caseworkers?
Oh, yes.
Okay, and this might explain why some people are saying, they changed my caseworker. I don't know who my caseworker is now. Is it because people are retiring and quitting?
We have people that retired that, of
Okay.
course, relocated. Some were like higher education related. But we've been trying to recruit. We've had maybe over, 12 ES workers.
Okay.
Close to maybe 30 packets.
What's ES?
Eligibility specialist. I'm sorry. I'm so used to using
And
those
so,
terms. Yeah.
and so, if I log into this thing and let's say you guys change my caseworker, am I able to see in real time who my new caseworker is in this My Benefit system?
Okay, so the caseworkers that you see on the notice, again, because we're going through this change, right, is we're doing a different kind of process, which is called the business processing reengineering, where there's no caseworker assigned. And there's other states that do this as well. So you take that process and you break it up by steps. So first you have the intake group. They take in the applications, they do the interview. Then you've got the pending group. So as the pending comes in, they work on that. There's a different set of people that work on different tasks,
Okay.
right? Change reports, periodic, expedite cases. So that's why if you see a caseworker, it doesn't mean that you're assigned caseworker.
Okay.
It's just that right now, because that's how the system is built, until we change it, then you'll see it differently. But right now, you're going to see a caseworker's name. But they should be able to talk to any caseworker.
Okay, and I got to ask this question.
Sure.
What, how often do the phones ring? Are they kind of off the hook?
The phones ring. I mean, I could be at my desk and I can see 7 phones lighting up at the same time.
Okay.
And so
You guys just don't have enough people to answer those phones, huh?
we don't have enough people to answer the phones, but at the same time, we're trying to process cases typically, right? So if I'm on the phone, and I did this myself with just to experience what the workers experience, is I'm processing a case, a call comes in, I entertain that case. It takes me hours to process that one case because I'm entertaining calls. So we're just trying to address all the calls that comes in the best way that we can.
So let's say I have Medicaid and I go to the clinic and I'm done with my appointment and everything, and it's time for me to check out or whatever, and I go to the business office side of the clinic, and they tell me, I'm sorry, but your Medicaid is not active right now. Before, I would have to call public health, right? And the caseworker, I guess, would I be correct? And be like, hey, what's going on here?
Yeah,
And then you guys would, whatever process happens, right?
Yeah.
Am I able to log on to My Benefits and at the very least send a note to you guys that something has happened, and please
Yeah, we don't
Please let me
have.
know what's
Yeah, we
going
don't
on.
have that. So our portal is limited to a certain degree. So
Okay.
we're not able to do that just yet.
Okay.
But
Is that a
usually
feature you're working on?
it's a feature that we're working towards.
Okay.
Right. Such as uploading documents, sending text messages to clients, all of these things. But what I do have to say is that usually the medical providers usually contact us to say, or they email us to say, hey, I have this client. Usually they don't take them in right away. If they see there's no eligibility, then the clinic will usually call us or email us to say, Don is here for his appointment and it's showing not eligible. So we'll pull that aside and we'll kind of work on that case to see what's happening.
Okay. And how quickly do you guys resolve stuff like that? Let's say if it happens on a weekday when public health is open.
When we get the call or the email, we usually work on it kind of immediately,
Okay.
especially if it's medical.
Okay.
Yeah.
Okay. All right. Is there anything else you wanted to add about this portal and what it does now and what it's being planned to do in the future?
Well, I just want to say that, this is just one stepping stone to make things more accessible to our clients. We understand, the benefit that's needed. We understand that you're feeding your families. And this is just one way for you to kind of access that information that you need that you would normally call us for. So like your notices, if you go on the web portal and you see your notice, it's going to tell you an appointment date. That's telling you, okay, this is the month I need to start getting my documents together and submit it, right? The other thing too is that we are looking at terms of the documents that we are asking. So there may be more reduction of forms that we could be asking for. That's what we're working with our federal partners.
Because transportation is a very big issue for many of your clients.
Exactly. You know, it is.
It's not easy for so many of them to
Yeah.
drive here and there, and sometimes some of these documents rely on other documents.
Yes, that's correct.
Which
right.
is crazy.
Yeah.
I'm so glad that you
Yeah.
guys are making these streamlines, and this
Yeah.
portal is kind of exciting. It's not fully functional right now, but when it is, it sounds like it's going to be a big deal.
Yeah, I mean, you know, our director, my division chief everybody's been really supportive of what we're trying to move towards. Again, if
I heard your division chief is a real jerk.
No. He's all about reform.
I heard he likes to. I heard he like. I heard. I heard he likes to just take a basket of staplers and just throw them everywhere in the office. No?
No. Not even close, Troy.
Their division chief is Kandit's third owner, Carlos Paglian, who has never been on our show despite being an owner. Did you know that he's a part owner of Kandit?
No.
You didn't know that? But he's done remarkable things.
He has.
Yeah.
He really has. He's really because I've been very supportive of the changes and the movement that we're heading. We talk constantly. Same thing with our director. We meet with him. He's very engaged in what we're trying to do. So again, it's going to be a win for the client. It's also going to be a win for our staff. It's going to just take some time.
I have a okay. John Nauta says, I called yesterday and I was told my caseworker has to view it. 2 weeks ago, I turned in what I was told to continue my benefits. Are you able to speak to that?
What was his question? I'm sorry.
He says, it's not a question. He's just informing you that he called, I guess, your office yesterday and was told that his caseworker has to view, I'm thinking he's saying what he turned in.
Okay.
He says, 2 weeks ago, I turned in what I was told to continue my benefits.
Okay.
He doesn't say when his 6 months or 1 year ends.
Okay.
He just, based on this, what he's writing, is there anything you have?
Yeah, so it could be a renewal. It could be a new application. Well, it says continue benefits, right? So I'm assuming it's a renewal.
Is it the 1 year one?
Yeah, it could be the 1 year renewal. So again, because the workers have to, when they get the renewal form, they're going to have to end up reviewing whatever he submitted to make sure that it's complete. Make sure there's nothing else that's missing.
But since he turned the form in and it was already received by your office,
yes,
he should not suffer any discontinuation, right?
Right. So when they process, so let's just say he didn't get the October benefit or November benefit, then again, when the workers do get to his case and they process, then they'll prorate it back to October.
Oh, so he might not be getting the benefit.
Right, maybe because it expired. Maybe the situation. So if the case expired, then of course he didn't get, like, let's say November benefit, right? So the worker has to look at his application, the documents, and then process it.
So even if he turned it in ahead of time,
yes,
because of the backlog.
Yes.
Okay, so I think this is a very important point to be made.
Yeah.
Because while you guys are working on the backlog, and then I'll ask you a question. While public health is working on getting to this backlog, when did the backlog start, by the way?
This happened
Was it because
right
of Malwar?
Before Malwar, yes.
Oh, the backlog happened right before. So,
yeah.
So public health experienced a backlog that began sometime before Malwar. So turn in your documents ahead of time, like ahead of time. Mr. Nauta is saying it was 2 weeks ago. I don't know when he doesn't say when his deadline was.
Okay.
But don't wait until the day before your stuff expires to turn your stuff in, because there's a backlog. My question is, how long do you think it's going to take before you guys clear the backlog?
You know, to be honest, I don't have a definite timeline. I know, like I said, right now we're towards the end of September that we're working on in terms of clearing out for processing.
How many, give me a guesstimate of how many forms you're processing.
Gosh, we can get an average of 500 applications a week.
Okay, applications
renewals.
When you say applications, you mean for new benefits?
Could be new. It could be reopen, which is people that come to reapply, and also renewals.
Okay.
So we can get about 500 a week of those coming in. That does not include change reports.
Okay, and how
PCRs.
many are in a pile waiting?
Oh gosh, I
Did you
don't
say
have a definitive
2,000?
number. It could be,
Okay.
it could be. It just, if you want to physically count, I can. But
So in
but
order for you
yeah.
to clear that backlog, if you get 500 a week, in order for you to clear that backlog, you at least need to be clearing 600 a week.
Yeah, practically like the ones that we get in, we should be clearing out. Supposed, yeah.
Okay.
So, but because again, the whole thing about the processing, it's supposed to be first in, first out, right? But of course, like I said, with the medical situation, like if they're in the hospital, then those kind of take priority.
And then when you guys have to answer a phone call or meet with a client face to
Yeah.
face. Oh, sorry.
No.
This is not directly related to this, but I'm just curious. How often do people at public health get sick? And in your division, the people who
Who are processing?
are dealing with customers directly, face to face.
I'm just trying to think about this week. It could be 3, could be 4.
Out of
If I'm just talking about I'm just talking about our submitting like location. ES workers, right?
Yeah.
I have about 10 that are there. So it could be 3 to 4.
in a week.
Could be.
Who will go down.
Yeah, it just, yeah.
So you're at like almost 60 to 70%
Yeah.
capacity.
yeah.
And
They're
simply
they're
because
burnt
people are
out.
getting sick.
Yeah, and because they're burnt out. So,
Well, I would think it's because of the face-to-face interaction
that could be
with
a
people.
possibility too. Yeah.
No, I'm certain that that's what that is. It's just,
You never know.
yeah. So anyway, main things to take away from here are, number one, you don't need a mirrors verification anymore for your benefits. Number two, register and log into the mybenefits.guam.gov portal to make life a little bit easier for you right now with the features that are there, and in the future with the features that are to come, right?
Yes.
Number three, if your 6-month or 1-year period is coming up, don't wait for the last 2 weeks before you submit your forms.
Yeah, you need to read on your notice of action. There is a deadline. It'll say your appointment on the bottom. So just make sure that you turn in your document within that month, or at least in the beginning of the month. Same thing with your renewal forms. It'll tell you a date. So again, just don't wait. If you've been on the program for a long time, then you kind of know the common documents that you're going to ask, right? Is there an income? If you're working, then of course you need check stubs or VOE, right? But most likely check stubs. If you're on SNAP and your children are 16 and above, then you have to have proof of school verification. It could be a school verification. It could be a report card. It could be a progress report. Just something to prove that your child is in school. Again, 16 and above, if you're under SNAP.
Okay.
But if you're under cash assistance, then it's all school-age children,
Okay.
where you have to get that kind of verification.
Okay.
Yeah.
Very cool. Thank you so much, Christine. I appreciate your time.
You're welcome.
And thank you all for tuning into this show to learn a little bit more about what's going on with the public welfare system on Guam and how things are being made easier for all of you. For Kandit News, I'm Troy Torres. God bless you and Hafiday.
Thankful for smiles. Thankful for friends. Thankful for hugs.
Thankful for trust.
Thankful for leaders.
Thankful for each other.
Thankful for our families.